Hello, I am Dr. Jean-Ronel Corbier. I am a board-certified neurologist. My certification is in neurology with special qualifications in child neurology. I am also board-certified in integrative pediatrics. What I'd like to do today is to share with you a little bit about our practice and center. But before I do that, I would like to share with you my background, because I think there are a lot of things about my background that explains why our clinic is the way it is and what we do. And so let me start with sharing you some experiences that I had when I was younger. I was born in New York City of Haitian parents. But by the time I was 13 years of age, I had already lived in 6 different countries. Our parents were missionaries in Africa, and we lived in countries such as Rwanda, Burundi, and also Ivory Coast, or Côte d'Ivoire. There, I was exposed to all types of experiences. I got to learn new cultures, ways of doing things. I learned to work hard and discipline. And in Ivory Coast, we worked with lepers. Leprosy is a condition that's mentioned in the Bible. It's an infection that causes disfigurement and a lot of heartache for patients that come down with this condition. There, for the first time, I learned about people that are ostracized and stigma, and I learned to develop a very deep sense of compassion, but also hope. A lot of these lepers were very courageous. And so I took in all of these experiences, and they shaped who I am today and the work that I do as a physician in trying to be compassionate and understanding other patients' problems and conditions. So with that said, after our missionary work in Africa, we came back to the United States and lived in Michigan for a while. It was time for college there. I was a pre-medical student. While there, I had the opportunity to meet Dr. Benjamin Carson on several occasions. He was already a famous pediatric neurosurgeon. I already knew I wanted to be a physician, but when I met Dr. Carson, I decided to go into a brain-related field. I settled on the field of neurology. Now, at first, I wanted to be an adult neurologist, but in my first year of medical school, I took a course, a required course in neuroscience, and the professor was teaching us something called neuroplasticity. Neuroplasticity is the idea that the brain is malleable. The brain can reorganize by forming new neural pathways. I was very excited to learn about this concept for the first time. However, the professor mentioned that by the time you reach adulthood, that neuroplasticity more or less goes away. And I must say I was very surprised and saddened, because then I felt, well, what else could I do to help the brain of an adult as a future neurologist if there was no more neuroplasticity? On the other hand, he mentioned that children had a very neuroplastic brain, that neuroplasticity was alive and well in children. So right then and there, I made the decision that I would go into the field of child neurology, and that's exactly what I did. Now, with the field of neurology, I wanted to make sure that I had the best possible education that I could have. I did go to medical school at Michigan State University in East Lansing, Michigan, but I did the bulk of my neurology training in Cincinnati, first at the University of Cincinnati, then the Children's Hospital Medical Center in Cincinnati, Ohio. But I also did additional training at Johns Hopkins Medical Center, and also the Mayo Clinic in Rochester, Minnesota. I wanted to get as much knowledge as possible in the conventional field of neurology. I've also studied at the University of Michigan in Ann Arbor. And I must say I enjoyed every single minute of my training. I learned a lot of disorders and how to approach them, and this was a very valuable experience. I've also had the opportunity to visit multiple centers of children with multiple handicaps and learned a lot of things firsthand, clinical but also hands-on type of things. I talked to therapists, nurses. There was another part of my training, though, that I want to share with you, because Later on, as I started working with patients, I learned that a more comprehensive, holistic approach is necessary. As far as my training, I have a little bit of a unique background, even as far as my medical training, in the sense that when I was in medical school, I also enrolled in a graduate program, a master's level program in interdisciplinary health and humanities. And for my thesis, I worked on a project that allowed me to work with various so-called alternative healthcare providers. First off, I took courses like medical anthropology, medical geography, medical ethics, medical history, and so forth. And as part of my project, I wanted to study the alternative healthcare system and to compare that with the conventional or allopathic MD model. And this project allowed me to spend a lot of time with chiropractors, naturopaths, even aromatherapists, and others. They were kind enough to let me spend a lot of time in their office, day in and day out. I would observe them, and then at the end of the day, they allowed me to ask any questions that I had, and believe me, I had bunches of questions to ask. But by doing this, I was exposed to a different approach to medicine, even in my early formative years of medical school. And so while I was doing this master's program, at the same time I was learning a lot of medicine, pharmacology, and other courses, and I was able to compare the two and to contrast them. But then, after medical school, I was back into the conventional world. Again, I mentioned that Cincinnati is where I did my neurology training, so for a while I kind of dove right into the conventional medicine and forgot a little bit some of the alternative lessons that I had learned, alternative medicine. And in fact, when I was in Cincinnati, by the time I finished, my goal was to become a pediatric stroke specialist. You see, I trained at one of the largest child neurology centers, and there they had a bunch of pediatric neurology subspecialists. I learned a lot working with pediatric stroke and was going to do this, but then later on decided that that might be such a narrow field that I should do something else. That's how I ended up for my first practice going to Alabama as a private independent practitioner. And there I started working with children with autism. Now to this day, I'm not sure why parents, a lot of them started bringing their kids to me with autism. Perhaps it's because I was a new neurologist in town, but parents would bring their children and would ask questions like, Dr. Corbier, you're new in town, we have a child with autism. As a neurologist, what can you do to help with this speech delay? Or our child has severe neurobehavioral problems and has been seen by various other specialists, neurologists, psychiatrists. Do you have something new to offer? Or parents would say, our child is not eating properly and we thought of a gluten casein-free diet. Do you have knowledge of this type of diet, and what do you think about that and other dietary interventions? Now, I did not know a lot back then because my training was such that I was not exposed to these things. But over time, with a lot of training, certification, medical conferences, and further investigation, I was able to address all of these things. And so today, one of my main areas of specialty is working with children with autism.